Welcome back to the show with myself, Nafisa Dango, and we're talking loads of positivity and, of course, trying to reach out to people that need all that help. Talking about reaching out, it is the winter months, and as we know, our skin never takes a break from protecting our body. But in the winter months, it gets profoundly worse to be able to keep that elasticity, that moisture. In this post, we're going to be discussing why it's so important to pay extra attention to our winter skin and review some of the most common troubles that can surface for skin in cold and dry weather, and provide tips on how to keep your skin healthy throughout the season. And joining me on the line this morning is Dr. Irshad Mohamed Essack, a healthcare practitioner specializing as a dermatologist. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Jazakallah, thanks for having me on your show.
Thank you so much for joining us this morning, and a warm welcome to the show. I'm always looking forward to having to chat with people in your kinds of spaces. Talk to us a little bit about yourself and what enticed you to get involved into dermatology.
Dermatology is a very interesting field in the sense that it is a super specialty of internal medicine. So like you have a GP who does general medicine, you will then have certain types of specialists, for example, an internal physician who will deal, for example, with hypertension, diabetes, kidney issues, strokes. Now, further to that, you have a cardiologist, for example, who will deal specifically with issues of the heart. A nephrologist will deal with issues specifically of the kidneys. A pulmonologist will do work specifically with the lungs. So dermatology is a subspecialty of medicine that deals with the skin and the skin appendages. So as time goes by, you'll find that you realize that the skin is a window upon many, many diseases elsewhere in the body. And a large proportion of general practice does entail dermatology. And a lot of the times you end up picking up problems in other organ systems or elsewhere in the body, but shows itself or manifests itself initially in the skin. So you would be dealing with disorders predominantly of the skin itself, disorders which occur elsewhere that present themselves in the skin. And then you also will deal with disorders whereby you have the skin appendages, so hair, nails, sweat glands, apocrine glands, nervous systems in the skin, vascular systems in the skin, all follow or fall under the ambit of dermatology.
Right. And I think it's interesting that you bring that up, because I think a lot of the times people don't realize that your skin is one of the biggest organs in your body. And the toll that it takes is unbelievable. And as you were saying, I think I found that very interesting, is the fact that sometimes what culminates on our skin is from somewhere else in our body, which is something that we really need to take heed of. So let's talk about winter. I mean, we know now we're in, going into a very bad cold weather and things like that. What about all the winter skin issues that people are going to face, and how do we deal with it? So let's talk it through.
Essentially, winter can be quite vicious on the skin, and the main problems with winter skin is predominantly associated with the skin's hydration and the skin's ability to protect yourself from a barrier point of view. If you look at the skin, when it comes to winter, dry skin will essentially be your biggest problem. And in humidity, in areas, for example, like Johannesburg, where the humidity usually is on the low side compared to, for example, coastal cities, skins tend to battle a lot more, become dry and tend to become itchy. Remember something, that dryness usually will drive itch will drive scratch will drive histamine release, and histamine then drives inflammation, which also drives itch. So now you get yourself caught into an itch-scratch cycle. And in a winter skin, you essentially want to break that cycle by keeping the skin essentially well moisturized in order for you to maintain the hydration in the skin. Because a poorly hydrated skin does not function well. It has got a very poor barrier function in terms of being able to keep the items that you want to keep out, for example, germs, bacteria, and what you want to keep in are predominantly the moisture factor because your skin is not designed to actually imbibe or to take in fluid or water through
Mm.
it. So if you are lying in a bath for a long period of time, if that was the case, then you essentially swell after 15 or 20 minutes,
Right.
like a Michelin man or an Oros man by the time you actually leave that bath. So we're not designed to actually take water directly into the skin.
Mm.
Um, by ingesting water or by drinking water, yes, it does have benefits in terms of the overall hydration of the body and the hydration of the skin. But that water makes its way predominantly into the vascular or the vessel or the arterial compartment of the skin, of
Mm.
the body. Little of that works its way from there into the dermis, which is the second layer of the skin, which is probably the area of the skin that is composed of the largest percentage of water. So to get
Right.
water in the skin, you need to have that water bound to something else as that something else gets absorbed into the skin. So winter
Right.
skins, when they become dry, they become itchy, they become irritated, they become inflamed, and they don't provide a good barrier protective
Mm.
function. Something that people tend to forget that is a function of the skin and would probably come into its own, especially in winter,
Mm.
is that your skin is just part of the skin's function is actually thermoregulation.
Right.
And your temperature regulation of your skin is very, very important in winter, because in order for you to not lose heat, you would
Mm.
reduce the amount of blood flow into your skin naturally. So that warm blood would be concentrated or rediverted more to central areas and away from the skin in order for you
Mm.
not to radiate heat, as opposed to in summer, whereby your skin will work like a radiator. So you'll increase blood flow to the skin, you'll become a little bit more red, a little bit more pink, a little bit more flushed, in order for you to radiate that heat away from your body to keep your core at its optimal temperature. So
Mm.
people forget that even in winter, we do have issues when it comes to the skin, and you can get certain types of vascular problems, for example, like Raynaud's disease or Raynaud's phenomenon, or
Right.
chilblains. And in extreme weather, for example, if you're talking about winter, if you look at the polar caps and people who are explorers and who are mountain climbers, for example, they run into problems like frostbite. But there is an
Mm.
example, a severe example of sustained low temperatures that also affect the skin.
Right. So let's talk, Doc. Besides we're talking about now keeping hydrated because, as you say, it's important for the skin to be hydrated. Besides drinking lots of water, what else is it that we can do to keep our skin in a good condition, especially during this winter period?
I think the fundamental or the cornerstone of a good skin regime, especially in winter, would be to use a good quality moisturizer. And contrary to popular belief, not all moisturizers are the same. You do get different categories of moisturizers, or you get
Mm-hmm.
different types of moisturizers. And one could very easily or broadly classify moisturizers into two categories. You get
Right.
those that are the occlusives. The occlusives are things that occlude or cover. An example of an occlusive would be something like petroleum jelly. Has this
Okay.
greasy consistency, but something like petroleum jelly doesn't necessarily get absorbed into the skin. So when you
Mm.
apply it onto the skin, it gives you this moisturized or shiny look, but it is on top of the skin. It usually doesn't
Right.
have much ability to enter into the skin. That's an
Mm-hmm.
occlusive. That's as good as you taking, for example, cling wrap and wrapping your arm with it. It's not going
Right.
to allow water to evaporate out of your skin, but it's not going to allow any water to get in either.
Mm.
And that is of value in a skin that is already well hydrated or very, very well moisturized, because you want to prevent the loss of water that's already in the skin.
Mm.
Then you come to the other broad group of moisturizers, which are the humectants. And as the name would suggest, these are items that actually bind water. And as they get absorbed, they take water with it into the skin. And
Mm-hmm.
they keep the water in the skin. Examples of this are things like cetamacrogol. Examples of this also are urea. And if we take urea as an example, urea is able to bind water about 100 times its weight as it gets absorbed into the skin. So you'll see a lot of moisturizers and creams that are available that will purport to have anywhere between about 2 to 5, even up to sometimes 10% of urea as part of their moisturizing formulation. So those are examples of humectants. Now, the good thing is that the best time to apply something like a humectant would be immediately after having a bath or shower. And the advantage of that is because your skin is still relatively warm and moist. So what happens is that that moisturizer that you are using binds onto the water. So you
Right.
generally not to want to dry yourself completely. And that formulation, usually a cream, would then begin to bind the water, and as it begins to get absorbed, it takes that water into the skin. And that'll be at least your one application for the day. You are more than welcome to continue using moisturizers at other times of the day. So, for example, if you're bathing or showering predominantly in the morning, that would be your one application at least. You are certainly welcome to use a moisturizer later on in the day, for example, around lunchtime or so, if you have the time or the need arises. And then certainly at bedtime, before you go to bed, you can use the same moisturizer as well, whether or not you have had a shower or a bath. It certainly would be of an advantage. So that will be a moisturizer that you would consider using predominantly after you've cleansed your body. Then people will ask, well, how do I take care of my body during a shower? Now, the problem is that most of our soaps, if I could call it that, they do have a detergent or an astringent type of an action on the skin. Your body naturally is able to produce moisturizers, and
Right.
usually the type of moisturizer that you produce varies with age, and the volume or the amount of moisturizer that you produce also varies with age. The older you get, the glands that produce these moisturizers tend to become a little bit more atrophied and less functional, and therefore
Right.
they produce less moisturizer. Therefore, you need to supplement this with something else. But by using a soap or anything as a general rule or guide that makes bubbles, bubbles will have an astringent or have a detergent action on the skin. Those lathers that we are often exposed to in certain advertisements, we are we are given the impression that there has to be a lather or a foam in order for us to keep our skins clean. And that
Yes.
to me is a misconception. What these lathers actually do is they begin to break down and they begin to strip the outer layer of the skin of very
Right.
important triglycerides, fatty acids, and ceramides, which form part of the skin's barrier function. If you strip those out of the outer layer of the skin, you then create mini or micro gaps in the skin. And that lends itself to increased rate and amount of what we call trans-epidermal water loss. So across the epidermis, evaporation that occurs. And this
So,
evaporation usually occurs.
so Doc, let me just come in there. When you're talking about the types of soaps we use, what would you suggest would be a good type of soap to use, especially during the winter? And as you're saying, a lot of us have that habit where we lather, then thinking that, okay, by doing that, we're of course hydrating our skin, when in actual fact, we're not realizing that we're stripping it. So what sort of advice would you give us when it comes to that particular aspect of having to look after your hydration in your skin?
For a non-diseased, non-pathological, normal skin, you could get away with these soaps or shower gels that lather on the body. You probably would not have too much of a problem. However, in a skin that is prone to being dry, or a diseased skin, for example, in a patient who's got eczema,
Right.
you would want to try to avoid those or anything that actually makes a lather or bubble. So that will include bubble baths, foam baths, because in an eczema situation, for example, one of the fundamental problems is that you're unable to bind down and hold on to water in the skin. So when I tell someone that your skin is prone to being dry, and then I tell someone that, but you should not be sitting in a bubble bath, it kind of it sounds contradictory.
Right.
But the longer you sit in a bubble bath, the more you're going to strip the skin of moisture. So what you're actually looking for is a soap substitute. And soap substitutes vary again in quality and in the ingredients. Soap substitutes usually don't tend to foam. And sometimes people feel that I'm not seeing the foam, therefore I'm not actually feeling clean thereafter. But if you're washing yourself simply with the palm of your hand, with a soap substitute in clean water, that is adequate to actually keep your skin clean, and well hydrated. And examples of soap substitutes would be those again that contain urea, and the higher the concentration or the percentage of the urea in it, the thicker the cream or the formulation will be. But a lot of these tend to be a put off for patients because they open the tub and they see this large cake of cream. But once you add water to it, it liquefies quite nicely and it tends to spread quite nicely. So urea would be an example, lanolin will be an example, and glycerin as well works very, very well in keeping the skin well hydrated during a washing process, but without
Right.
stripping it of essential moisturizers. So those are
Okay.
going to be some of the examples of soap substitutes.
Okay. And then some tips for keeping your skin happy during winter. What other tips would you give us besides, of course, the showering and the type of moisturizing and hydration that we can do? How else would we look after our skin during this winter period?
What you can do is, if you are somebody who likes taking baths, for example, no one is saying don't get into a bubble bath, or no one says don't get into a bath because it is relaxing for you as well. But if you want to spend time in a bath and relax, then try to avoid bubble baths. There are lots of bath additives that are available commercially, which you can add into the bath water. Again, don't expect bubbles because that's not the intention. But you can use bath additives as well to soak yourself into the bath. You can add simple items like rough salt into the water. It changes the tonicity of the water and helps the water to then basically pass into the skin. So bath salts are also of an advantage. Just be careful that if you are eczema prone, you may want to stay away from those that are colored salts, or those that are fragrant salts. Even simple rough salt will basically do the job for you. And make sure that you are moisturizing your skin on a regular basis, and don't complicate the regime. Try to stay away from exfoliators as far as you can. So in other words, bath exfoliators, because what they do is they tend to, or they are intended to polish the skin from the outside. In doing that, what you end up doing is you tend to remove one or two of the dead layers from the outside. And what that does is, yes, it does give your skin a good glow and a polish and a shine. But if your skin is prone to being dry, you are
Right.
making it easier for the water loss to occur. It occurs faster and it occurs to a larger extent. I tell my patients that if you're coming out of the shower, don't apply your moisturizers after you've just patted yourself down with a towel. Don't leave the bathroom itself. And I understand that people will die for a heater or a fireplace because it is cold. But if
Right.
you are still in the bathroom with the door closed, there's still a bit of moisture and humidity from the steam that's in the bathroom. Start applying your moisturizers there, then dress, and then exit the bathroom. It'll certainly be of a great advantage. And when it comes to children as well, giving them a bath or a shower, preferably at least once a day. If you're going to overdo the bath, again, the rubbing action of trying to clean the skin tends to remove the outer layer of the skin. It also
Right.
exacerbates and promotes dryness.
Okay.
So
I
just
understand
keep
you there.
the skin regime as simple as possible.
Right. What about wearing the appropriate clothing and, of course, always carrying lip balm, because we know our lips also get affected during this particular winter period.
The lips actually are a special area of the skin. The thing that makes the lips different is that the lips are usually devoid of the outer 2 to 3 layers of the skin. And that enables us to actually see or appreciate the underlying vessels and muscles a lot better, which gives our lips the color that they have. That having been said, it's an area that is therefore more prone to the development of dryness. They chap easier, you get fissures or small slits or cuts within the lips. And that becomes a problem in terms of eating and speaking. And now with us having to wear masks because of COVID, that those frayed edges of the skin on the lips tends to catch on the inside of the mask and makes patients a lot more uncomfortable. There are some good quality lip balms as well available, and in fact there are some creams as well that are packaged in small enough volumes for you to keep in your pocket for you to apply on a regular basis onto your lip. You must remember that in terms of formulation, in terms of moisturizing as well, a greasy item is not necessarily a better hydrating item.
Right.
Right? Like I said earlier, a greasy item may be composed more of an occlusive rather than having a humectant. Okay, so you must differentiate between that. But as a general guide, if you look at within any one brand, a lotion will generally be a lot lighter in texture compared to a cream. And an ointment or an emulsifier will be a lot thicker in texture compared to a cream. So perhaps if you're somebody who feels, for lack of a better term, greasy with the application of moisturizers, then you should at least be on a lotion. If you find that doesn't make you feel hydrated enough, then move to a cream. And if that's insufficient, then start moving towards the emollients or the ointments. And that's more or less how you should position yourself in terms of your moisturizers.
Doc, very quickly, we seem to be running out of time. What about your hands? You know, it's a period now where we're constantly using sanitizer, and it's taking a toll on our hands. What sort of advice would you quickly give us with regard to that?
Absolutely. I am seeing a lot more patients who are developing contact dermatitis and hand dermatitis to sanitizers. Unfortunately, alcohols are a major component in sanitizers. The higher the alcohol component, the better it is as a sanitizer, but the more vicious and drying it is to the skin. My suggestion would be, in terms of sanitizers, is try to find a sanitizer that has got an emollient or a moisturizer in it, and there are those that are commercially available out there. Perhaps get yourself your own personal bottle, keep it in your handbag, because one visit to a mall or to several shops, you're going to end up exposing yourself to a variety of sanitizers in a half an hour period. So maybe get hold of one, keep it in your handbag at the point of entry into the store, take it out of your handbag, show the staff that you are sanitizing. So you're using one particular sanitizer on a regular basis. So you are eliminating the variety. And then over and above that, perhaps before your trip to the store or before your shopping expedition, wash your hands at home first, apply a good quality barrier cream first. So you've now moisturized your hands, and you've now basically are going to sanitize subsequent to that as you enter the stores. But the fact that you have a good quality barrier cream onto your hands already will reduce the irritation from the sanitizer. When you get back home again, wash your hands again as you would do with water, and then thereafter apply a barrier cream almost immediately thereafter.
Okay, lovely. Doc, we seem to be running out of time. One quick message before we go.
I think the winter period here, especially in places like Johannesburg, is usually underestimated. We find a lot of people who cope quite well during during summers, and then as the winter begins to approach, they begin to become a lot more irritable overall from on their skins. I think your skin deserves a good, simple moisturizer. And if you keep your overall skincare regime to a soap substitute and a moisturizer in winter with regular use, you should be fairly well off through the winter. If you find that you are using excessive moisturizers and you are unable to manage your skin, I think see at least your GP, preferably a dermatologist, so we can kind of tweak your regime to keep your skin in good stead.
Thank you so much for joining us this morning and enticing us into having a better skin regime, especially during this winter period. So we really appreciate all your valuable advice. Thank you so much for joining us today.
Shukran, Jazakallah for the opportunity, and thanks for having me on your show.
It was only a pleasure. You take care. Assalamu alaikum. That was Dr. Essack giving us some skin regimes for this winter period, especially now. We know our skins are starting to take a toll, especially with all those sanitizers and that. We seem to be reaching the end of the show, but I want to take some time to ode myself and our viewers also to say that the importance of looking at the Palestinian people in Gaza and their plight and the type of situations that they're in, and not forgetting their plight. I mean, Nelson Mandela said, we know too well that our freedom is incomplete without the freedom of the Palestinians. So what I'm saying is, let's all go out there and do some form of support structure, even if it's just going to a cake sale or carrying on with one like they did the other day. And of course, praying for them, because I think it's a very difficult period that they're going through. So let's look at that and not forget those that are in worse situations than ourselves. But on a lighter note, I want to thank you for joining me this Thursday, into enticing you into better places, better spaces, and of course, try to create that empowerment out there by showcasing people that are in dire need. And we're saying, let's reach out there and let's help each other create the support structure of empowerment, upliftment, and sustainability. From myself and the team, we want to thank you for joining us, and we look forward to chatting to you same time, same place next week, Thursday. From myself, Nafisa Dango, Assalamu alaikum wa rahmatullahi wa barakatuh.